You're watching Capital City Sunday.
The Chippewa Valley is dealing with the fallout over the sudden news that 2 HSHS hospitals and multiple Prevea clinics are permanently closing. HSHS operates 2 faith-based hospitals, Sacred Heart in Eau Claire and St. Joseph's in Chippewa Falls. Prevea has multiple locations, including Altoona and Menominee. In a press release, officials said the decision to close comes after, quote, prolonged operational and financial stress. The majority of the closures are expected to be done within the next few months. The loss of Eau Claire's oldest active hospital and Chippewa Falls' only hospital is far-reaching and acutely felt in these communities. 1,400 workers will lose their jobs, and the region loses some crucial healthcare services like substance abuse and mental health treatment. Members of the community are protesting the decision and trying to find solutions.
Community, save our hospital, save our community, save our hospital.
After the news broke, dozens of people gathered outside Sacred Heart Hospital to make their voices heard. One of those protesters was a nurse at the hospital for 6 years. She says everyone is in shock.
It was more than just a hospital. There was hope here, there is hope here. People who have worked elsewhere that comes back to Sacred Heart, they can tell that, and the patients as well. And it will be hard to transition.
A regional task force formed in response to the closures. Anchor Keith Edwards sat down with Aaron White, a task force member and Eau Claire's community development director, to look at the region's next steps and search for solutions.
Well, I'm here now with Aaron White, Eau Claire's community development director and a member of the newly formed task force to respond to the healthcare closures in Eau Claire. So Aaron, thanks for being here first.
Absolutely. Glad to be here.
So let's talk about this announcement. Was there any warning that this was coming?
No, we did not have any advance notification, which is very common when a private business makes a decision to shut down or close down. I think overall we knew that healthcare in general is having issues across the country, across the nation, and across the state. But this was definitely a surprise.
Could the city have helped if they had known earlier?
It's unlikely that we could have taken any direct action. You're talking about a private business that has to still generate revenue and be able to operate. There's very few routes that a city can take to, change fundamentals of billing and generating revenue and paying expenses. There may have been some things we could have helped if they were working on a deal outside that might have been able to assist, but really there's probably very little that a community can have directly stop something like this from occurring.
Okay. So tell us about this task force and what you aim to accomplish, what the task force aims to accomplish.
Certainly. The task force is a group of organizations and individuals with a vested interest in the success of the community and in the success of our healthcare system. There are folks from other healthcare providers, a variety of business leaders, legislators, both local, state, and federal, all coming together to look to see what can we collectively do as a group to help find a path forward as HSHS deals with the unwinding of their network. We don't know what that looks like yet. Right now, we're in the very early phase of still gathering information, unpacking what's led up to this situation, what services are we getting cut off from, what can be potentially spun to other organizations or can pick up the slack or other organizations could potentially pick up. There's a whole lot of questions that we're looking to get answers to and get the information for that we can kind of help provide a cohesive direction to move forward and make sure that healthcare stays prominent within the Chippewa Valley.
So after all the dust settles, what would measurable success look like?
Ideally, we find a way to make sure that we don't lose any of our critical services. There are certain things that HSHS, the Sacred Heart facility, or St. Joseph does for the city of Eau Claire, for the city of Chippewa Falls. So the first step is to make sure that there's that continuity of care. The services are there. There are providers that can pick up any services that are at risk. Because we're talking about people's health. We're talking about families. We're talking about folks that may be critically ill. We want to make sure that they have the health care they need to get healthy or to manage their conditions.
Okay, so the task force met earlier this week. They divided into subcommittees. Can you tell us about those subcommittees and how they were formed?
No, absolutely. There's a number of them. I don't have the organization chart in front of me. The Chamber of Commerce would be able to provide you a full org chart. Sure. but they're really intended to look at different aspects of it. There's a governance aspect. Where can the legislative bodies, the local governments step in, and what roles can they facilitate? There'll be groups that will look at, as I mentioned, what services are provided, exclusively at HSHS. How can we pick those back up? Who else can pick those up? There are groups, the task force, or the subcommittee that I'm with, that I'm one of the co-chairs with, is looking at how does that facility look? If it's picked up again as an existing hospital, or if those services are able to be split out amongst other areas or standalone organizations, what is a large facility that was a hospital? If it's now vacant, what does that look like? Again, kind of looking into the future, looking into number of possibilities, number of tracks that might go. Ideally, we want to try and keep it as maintained, as integrated as possible, but you just don't know what that is. So there's just a number of these areas that a lot of it, like I said, on the starting point is just gathering information, finding out more about what's going on, who are the other players in the healthcare industry in this area, and how do we all come together to find a solution.
So what are the next steps for the task force then?
So we are starting to meet regularly. The different chairs are setting up their schedules on how often they'll meet and what information we're immediately trying to secure.